It's terrible. Architectural engineers have already said that even if we fix the Hagåtña pool and close off all the leaks and stuff, it'll leak again because it's basically sinking. So
Yeah, it's a swamp.
we're not going to do it there. We're probably going to do it up in Dedido where the sports complex is, because there's already a pool there. And you know, we really want to do more than one. And so the one to replace the Hagåtña, we can start doing that in Dedido. So
Good. Something to look forward to.
I sort of wanted one, you know, like in Tijan. We're trying to look at Tijan and make that like a recreational facility area. But it's quicker to do it up in Dedido. So we'll do one in Dedido and maybe we'll look at another one in Tijan.
Wonderful.
Gov, I heard that I'm sorry.
Sorry, Bill, or somebody.
That was me, Gov. I've heard that some of the homeless folks down in Hagåtña have found their way into the Hagåtña pool. Is there anything to get them out? Only from the risk standpoint, if they fall in the pool and drown, you know, somehow it's the government's fault if they weren't formally kicked out.
There's no water in it, so
there's no water in it. Okay. Okay, yeah. Well, I thought there was muddy water in there.
I think we locked those bathrooms. I'll have to double check, but I think we locked them. Anyway, it's an ongoing challenge for the homeless. Yeah.
Well, maybe the polo team can sell swimsuit calendars to raise funds. Right?
Well, we used to have ladies' nights, and one time we raised $6,000 on one ladies' night. I don't know if the governor was there, but we invited all our wives and girlfriends, and it was a good fundraising.
The wives and the girlfriends were there.
Well, different people brought their wives, and other guys just had girlfriends. That was back when we were young, and Rainer Terlahi was dancing in his Speedos.
That's weird. Okay, on that note, we'll start the meeting. Welcome everybody to our weekly meeting. Thanks for showing up. This will be the last meeting this month, as next week will be Thanksgiving. So I don't think we would want to see each other's faces on Thanksgiving. So some quick things to take care of. Next week we'll be delivering our turkeys to Salvation Army, the Alley Shelter or Catholic Social Services, which will team up with a couple other groups, DYA and Sanctuary. So there's a total of 30 turkey dinners that will be given out. We'll get some pictures and we'll share them with the members. Next month is the Christmas drop. This year they're shooting for like 126 crates. Last year was 170. So in the next a few weeks, I think December 5th is when we're going to put all the crates together. If you're willing to donate, or if the company you're with wants to donate, I'll put on who to get a hold of. But they're looking for maybe not food or anything like that, but more of fishing supplies, tools, tape, screws, hammer, nails, camping gears like shovels, boating safety, life jackets, mirrors, things like that, fishing lines. So if you're willing to donate, I'll put that out in the group chat, and you guys can get together with whatever company you're with. There's sponsorship packages of $500 to $1,000, or $300 or $1,000. So if you're interested. Any questions? Cool. I want to our special guest. We have ADG Lucky with us. Thanks for joining us today. And and without further ado, don't want to take up too much of her time. I know she's very busy. We have guest speaker this week is honorary Rotarian, and of course, the governor of our island, Governor Leon Guerrero. Welcome. And the floor is yours. Please go ahead and address the club when you're ready.
Phil, thank you again for asking me to come speak. We're doing this virtual way. I think the last time I was with you guys, we were at 3 Squares. So I really do miss the fried chicken there, and hopefully maybe soon we'll be able to be doing fried chicken again at 3 Squares.
Yes.
But I wanted to maybe just touch on a few things that maybe would be of interest to you. First, I just wanted to say that as far as government finances, I know that's always been a concern for people. We closed out our fiscal year 2019 and we had an audit, which was a good audit. And we retired the deficit of about $83 million by 42%. And that's good. That's a good, I think, statement being said about the finances of the government. We continue to be very much frugal in our expenses, and we continue to collect aggressively. And fiscal year 2020 will also, I think, be a very good fiscally disciplined year. So far with 2021, with just October, we are collecting what we have projected to collect. And you sometimes think, how could this be in a pandemic crisis with, businesses closed, the economy not doing good? I have to say that part of it is being stood up by military construction projects. It's also being stood up by military spending, federal spending, local spending. And as you know, we were allotted over $1.4 billion in federal finance assistance. I am concerned about what's going to happen after December 31st because the pandemic unemployment will expire. Coronavirus funds will expire. Some of the federal monies can go on, but for the most part, it will expire. So the US is not doing very good in its containment of the virus. You guys read the paper, you guys listen to national media. They're going worse than the first two waves. And I'm pretty sure with President-elect Biden coming in that he will do something for more financial assistance to states and territories to help with the economy and help with people who's not working, people whose businesses are closed, people who worry about their jobs and worry about, where they're going to get their next meal. And certainly we'll be working very closely with the new administration, just like we did with this current administration. These 9 months, it's been now 9 months since this coronavirus, I think, has started. And in the very beginning, public health was tracking the coronavirus. When we got our first 3 positive cases in March 14th, I think, of 2020, I immediately asked people to stay home. We closed businesses. We closed non-essential government businesses. And I think as a result, and people really complied to the directives, and we were able to contain the virus. You guys saw that for at least March, April, May, June, July, about 4 months. We were going along with maybe 1 or 2 or 3 cases a day. And then I think it was in August 14th, where we then issued another strict stay-at-home policy and directive because we started seeing more surges. And we went up as high as 100 a day. So that wave, we are really slow to get a downward trend in terms of positive cases. So here we are now in November, And I think we're experiencing a third surge with the construction industries. I know some people out there are yelling to close off or do another stay at home, shelter in place, more restriction. But I just want people to remember that we're still in PCOR 1. And we still have a much more, I think, restrictive measures in place than most of the United States. Bars are still closed, in dining restaurants are not allowed, and other things. Schools are not allowed, just various places where we think maybe there might be a high risk of exposure to more community spread. So, with the construction company surge and people yelling lockdown, lockdown, I think I am taking a much more a much more targeted approach, and with advice of our PAG and our surgeon cell and public health, these clusters is what's causing the surge again. And for example, with Black construction, they tested about 1,200 of their employees. Out of the 1,200, there's about 570 that are positive. We're seeing Cortec also rising. And but with the cluster, you're able to contain it, and you're able to target more. You isolate them, you take them out of the community, isolate them, and that's why you're starting to see now a downward trend in the positives. Again, it's not going down as fast as I would like it to be, but you'll see that the trends are going down. And we've also looked at a simpler, I think, way of a metrics. You guys probably heard my strive for 5. And what I wanted to do is look at our CAR score. And if our CAR score goes down to 5 and remains below 5 for 2 weeks, then, I feel more comfortable that we can enjoy the holidays. I don't think we're going to make it for Thanksgiving. I am waiting for guidelines from CDC about Thanksgiving, but I get all these close it all off, don't do Thanksgiving, or open it all up and do Thanksgiving. But what I want to see is what our numbers are this week, over the weekend. But I do want to say that most of these positive tests that we're seeing and positive spread is from social gathering. It's people not complying to the social distancing, not complying to wearing masks, not complying to washing their hands and so forth. So we're seeing that. So it really puts me in a very, I think, precarious situation. What do we do? Do we close? Do we not close? With advice and others, we may do based on what the guidelines are. I'm actually very nervous about even saying Thanksgiving, because I know people are not going to comply. I know people are not going to wear their mask. I know people are not going to limit their number of people in their in their homes. Some states are doing Thanksgiving, but only for their immediate household and only at a number of 6. Some states are saying you could do 3 households or 2 households, but each household only has to be 6. But really, how do you monitor that? We're seeing numbers out of Canada that did their Thanksgiving and 2 weeks ago, and now they're seeing a rapid, again, surge of positive cases. So it's a very difficult situation, because we know how we like to be with our families and be with Thanksgiving, but also, we need to also remember that if we could just be a little bit more patient, not social gather, not congregate, so we can enjoy Christmas. So when going back to the CAR score, you guys probably already know that that's the metrics that we're looking at. What the CAR score takes into account is your incidence of new cases per day. And it also tells us how well our testing is able to identify these cases and the rate of spread. So it's a better metrics for us to look at. And we look at it on a 7-day rolling period, which gives us a much more better reality look of what is happening. Again, in order for us to relax some of our restrictions, I'm challenging our people to work towards a CAR score of 5. And with a CAR score of 5, I can feel comfortably that we could celebrate the holidays and spend times with families and still keep the community safe. But there are going to be guidelines, and when we do socially congregate there, I would like to have it in a much more controlled amount. And I'm also looking at the CAR score, and I'm looking also at the hospitalization, because this whole thing is to protect the ability of our hospitals to provide quality of care. It also, of course, is to help prevent lives being infected by COVID, and also to help protect deaths, prevent deaths. As you know, we are now 101 in terms of fatalities. That's a lot. Every day I see about 2 or 3 passing away. And these are people I know. These are people that are in their ages between 37 to 73, 74, some older, but not as many in the 80s and the 90s. But it's roughly between that age group of between 37. I've seen a 37-year-old. Of course, we saw a little boy at the age of 11, or 9. I think the boy was 9 years old. So, it ranges. This virus doesn't discriminate. And it's very deadly. I have to say it's very deadly, very serious. I have talked to families whose loved one have passed away from COVID, and they would tell me stories like, Governor, my husband just called me on the phone and was telling me he's ready to go home in 2 days. And then the doctor the next morning calls her and says her husband passed away. This is how unpredictable this virus is. And, we are taking it very seriously. I do appreciate the business community also in being very responsible for the most part. I am totally appreciative of the construction industry, whose cooperation is amazing. Why? Because they do also want to protect our people, and they do also want to provide safety for our people. I spoke to the Contractors Association. I spoke to James Martinez before we decided to close off the construction sites. And, although of course he was very concerned, he was also very cooperative in saying he would support the decision as something that needed to be done. And so when I say I take a targeted approach, is just that, I didn't go back and close and be more restrictive, because I knew it was a cluster situation. It wasn't an increase in community spread. It was more a cluster situation, and we took control of it and we dealt with it. My fear about that is the local workforce that also worked for Black Construction and worked for Cortec. As far as the H2 workers that are affected, they're all in the barracks. They've been isolated in the barracks. The barracks has been designated as an isolation facility for those construction workers. But the local workforce that have been infected is my fear, because they're out in the community. they go to church, they go to the grocery stores, they go to the retail stores, they go places, and they are a high potential for community spread. But so far, I think we have recognized it early, and we are monitoring them a lot closer, and so forth. So, you know, I'm asking the Rotarians in any way they can to put out the message about wearing your mask, social distancing, washing your hands. I think if the business community got out there and talked more frequently about that, working with their employees, I think we would have a stronger force to fight this virus. Vaccines aren't targeted to come in November. I don't know where that came from, but and I did not say it's coming this week, and I never said I'm mandating everybody to take it. So I also want to let you guys know that, you know, there's a lot of rumors out there. There's a lot of media misinformation out there. I want you to be guided by the official JIC communication, and also any directives coming out of the office of the governor and public health. It's rumors that are out there that are not substantiated as true, that is really causing a lot of anxiety and a lot of uncertainty, a lot of fear among our people. I also, again, want to challenge you to please help out. It is you that is the solution. You know, like the Surgeon General said, it is really the community that are the frontliners. The community are the ones that will win this battle against coronavirus. It's us, all of us, taking responsibility and not going out there if we don't have to go anywhere. When you do out, wear your mask and social distance as much as you can. Anyway, I'm open to questions or anything that you think I should address. If I can, I will.
Governor Bill Hagan here. I have a question. If you knew last April that you would have 100 deaths by this date, what could we have done different?
I think what we could have done differently, Bill, is be much more educational out there. You know, be much more communicative out there. In April, when we first did this, I think also, Bill, everybody was scared, right? Everybody was concerned, and everybody felt like if you all get together and just do what the directives are, we would win this.
Houston,
and Bill, I'll tell you, we were almost there. We were already in phase 3. The only activity that I did not lift restrictions from was the senior centers. But we lifted almost everything, right? It was like, man, we were right there. I was ready to say, okay, tourism, let's work with everybody, blah, 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 right? And then all of a sudden you saw that rapid increase from an individual and who infected a group of people, and that group of people infected within their own community, and that community infected the rest of the community. I think we've got it under control because we have instituted strategies. Like, for example, the rapid engagement team that we have done, where we have gone to these communities, gone to places where we felt was the increase in positive cases. And we went door to door and we tested people door to door, right? And we took them and we isolated them. We're seeing the results of that now in a very positive way.
Yeah,
but
about inside, huh?
What we did in everything that we did in April, Bill, we have done in the second part. We have. The only thing I didn't do in the second was the roadblocks, but we closed everything. we went back to PCOR 1 and we closed everything. My thinking is that the people are they're relaxed in their, they think they won't get it. And I don't know what else to do to impress that this virus is going to happen. It happened to me. It happened to, and I go home and go to work, and that's it. It happened to Josh. It happened to people that I know. And I'll tell you, when you get it, I was scared shit is just to put it mildly, right? Because I didn't know what this virus would do the next day. And even the doctors were saying, okay, Governor, your window of getting really bad is closing, right? So there was a period there of about 6 to 10 days where, I was already saying, if I died, my kids are fine, my family's fine, I'm okay with that, because that's how serious this virus is. So when you ask me what else, what I'm doing now is saying to you guys, here's the metrics that we should work towards. If we can work towards that metric and keep that metric at that level for 2 weeks, I'd feel more comfortable with the holidays.
Governor, I have a quick question. My wife's planning to come back from Japan on December 20th. What's going to be the restrictions? Will she have to
For
go
quarantine?
Yeah.
For quarantine?
Yes.
So, yeah, that's another thing that I'm looking at, Dave. And if our numbers are really down, I'm okay to do home quarantine rather than everybody coming in. The reason I did this, Dave, everybody coming in has to be quarantined because the cause of that surge is a person that was given self-quarantine and violated the self-quarantine and went off, and so at the time also, I think Japan was starting to rise again. I think South Korea was starting to rise again. And of course, the United States is going bananas still. They're going crazy still, right? I don't think they ever really controlled it. Like New York, for example, New York controlled it, but now they're surging again. So, so I'm looking at this, Dave. If we can contain it at 5 and below, I'm not adverse to discussions of changing our quarantine. There's no discussion right now about changing the quarantine, but if our numbers are starting to get better, I don't, we will still have to quarantine. Where we quarantine is probably what the discussion would center around.
Right now, as it stands, it's quarantined in one of the hotels.
Yeah.
Okay.
Right now, when you come in, and we sort of changed it. We did change it. Before you had to stay for the whole 14 days. But now you come in and you get quarantined, and on the 6th day, we give you a test. And if your test is negative, then you can do the rest of your quarantine, the balance of your quarantine days at home.
What about if they have a test prior to arriving within the 70?
Yeah, no, it doesn't matter. We still quarantine them.
Okay, for at least 6 days, right?
Yes, right.
Okay, thank you.
And
Governor,
there's a
if I
difference
may,
between the quarantine and isolation, because we also have an isolation facility, Dave. So, for example, if you are positive and your home is not conducive to home isolation, then we take you to the government isolation facility.
Okay, thank you.
if I may, Governor, of course, it's not just the US that's increasing, it's worldwide. Most European countries, except Sweden, which didn't do the lockdown. But I don't want to get into, lockdowns work or not. But do we have locally on Guam, do we have access to the medication that has proven to shorten people's time in the hospital? And do we see that working?
So we do have, they do treat you with the prednisone, and they also treat you with the remdesivir. It's called remdesivir. Some do make it and some don't. We're given 50 vials of the antibiotic. It's not antibiotic, forget, it's a mononuclear whatever. It's what President Trump, they gave him. We have 50 of that, and that's something that you have to be eligible to get that medication, and I don't know what the eligibility criteria is, but we do have the I can't say the remdesivir.
And do we see it working, or there's no change? Because of course the problem is people with underlying conditions, and we have a lot of those on Guam. So if we can control that somehow with medication. And then my second question is on the PCR test, where there's some arguments we see from public health. They're always over 10% positive. There's like 12, 14% positive of all the tests that they get. There's been talks about the cycles that are done. How many cycles? Are we getting a lot of false positives? Are we double checking those results? Because, you are making very important decisions based on positives. As a member of the community, I don't know how many, for instance, the construction workers, were they all symptomatic, asymptomatic? What kind of percentage was there?
Yeah. So you're talking to the specificity and the sensitivity of the machines. So the PCR is considered, I think, 95% sensitive to the virus, to the RNA of the virus. And so the doctors, if they have a question about the test results of any of the other ones, the Abbott rapid ID Now tests, they would have it checked with the PCR. And when they get the PCR results, that's really what they that's what they decide and diagnose on. There are people, Paul, that are negative, but clinically they show the results of the virus, right? Their chest x-rays and so forth. But for some reason, they are negative. Not very many of those, not very many, but in those situations, they treat them as positive and they treat them accordingly. So the PCR is about 95% sensitive. The rapid Abbott, I think, is about 85% sensitive. So if there is a question about the results of those machines, they would defer to the PCR.
Governor Bob Kelly here. I got a question for you. First of all, you're in a thankless position, so thanks very much for all of your work. We do appreciate all that. The other question is, what's the likelihood of school in January?
Yeah, even the DOE people are looking at, right? So Bob, again, if the numbers are contained, then of course we would look at the guidelines and we'll consult the various schools about opening. I do want to let you know, though, that when they do open, that we would like the schools to allow parents to also distance learn their kids if that's what their comfort is, right? So that there should be a high, because just from anecdotal information and also from the survey that Bank of Guam and ASC and ADAS Trust did, it showed that I think over 65% surveyed do not want face-to-face instructions. So, you know, that all has to be weighed on. But, you know, DOE is looking at opening in January also if things remain contained. But you know, they're not making that decision yet. We see what's going to happen. And plus, I don't, like I said, if the numbers, if we just all work together and get those numbers down and then contain it, right? It's not just to get it down, but contain it.
Thank you.
Governor, on the question.
Sorry, go ahead. I'm after you.
Okay. Hi, Governor. Steve Kasperbauer here.
Hi, Steve.
Hi. Hey, I have a question. I know a lot of folks who they tested positive, they went through quarantine, but they can't get through public health to get released. And they have been cleared for already 2 or 3 weeks. So they're losing 2 months worth of work, because what happens is they may feel some symptoms, so they stay at home. They get tested positive. They wait 7 days for that test. Then they're quarantined for the 2 weeks. And then after that, they're supposed to be the follow-up, but it takes 3 weeks or more. So there's a big frustration. What can we do? Because some of the numbers, they never answer for those people, and they're just stuck. And they end up having to wander around and figure out something because they know that they're cleared, but it's been 2 or 3 weeks. They can't get through.
Yeah, I know with that, Steve. People have called here also, and even families, like I said, that I've spoken to, who said, oh, you know, that they're just waiting to be cleared. Yes, there is a backlog of the clearing with public health, and they realize that, and so we're throwing in as the resources that they need to get it clear. They are in the process of trying to close that gap. The physicians advisory group is also going to be discussing that tonight, and see if maybe because right now really the only entity that's authorized to clear is public health.
Correct.
And so there may be some discussions about maybe allowing that and delegating that to physicians clinics also, so people can, you know, be cleared through their physicians clinic. That's going to be discussed this evening. So yes, we recognize that. That is of course, like you mentioned, a big concern for the employee and also for the employer. So we're trying to close that gap. We're putting in more resources, and public health is getting ready to be more automated so that this can happen faster.
Yeah, I'm thinking if you can have a condition with the clinics that they can have an express line just for that they are people who are under public health, they have a number, et cetera, they can come in, they can get cleared. And once the physician sends it to public health and they have a receipt, even though public health hasn't acknowledged it, although they have the receipt from the physician, then they can get back to work. Because maybe you'll never get caught up in time and they'll just go deeper into despair financially. So that would be my recommendation.
Yeah. And they are discussing that, Steve. Thank you for bringing it up.
Hi, Governor. It's Kaz. How are you?
I'm good. Thank you, Kaz.
Just 2 things, really. One was I was wondering if you could give us an update on the COVID app implementation and if it's been successful. If so, what are the metrics on that? If not, what do you think is missing to get that more adopted? And the second one is with regards to rev and tax and permitting and licensing. I know that there's been lots of sort of, you know, like little temporary fixes like extensions and so forth. I know that there's been extensions and so forth, but perhaps since this virus is going to continue for much longer than anybody really anticipated, perhaps it's more wiser to automatically extend expiring licenses and permits for 12 months, as long as people turn in payment for those without having to go through the arduous paperwork process that, you know, currently required to to just register and be lawful, you know? And so that's the suggestion I have with Department of Revenue Tax, just to extend businesses in good standing, their license and even driver's license for a period of 1 year, so they don't have to come in and submit new photos or anything like that. Just have them pay the permit and they're good to go. And the first question was about the app implementation, whether it's been good, bad, where we need to improve, how we can help.
Yeah, so for the COVID alert, right? You're talking about the COVID alert cost?
Yep, correct.
Yes.
Yes.
So right now, according to our GVB numbers, that they are about 31% of the targeted population, which is 73,200, which is the targeted number. I think those numbers have been increasing daily. So we continue on to making the education about the COVID alert. And so that's where that is in terms of update. As far as the business license permitting and the driver's license, Daphne's really, you know, on top of that. She has extended, as you know, she's extended the driver's license. I'm not too sure about the business or the permitting, but that's something that I will bring it up to her to like you say, approve or, you know, relicense those in good standing.
Yes, I think that would save a lot of stress for a lot of people out there that's already dealing with so many logistical issues. And I think
Yes.
that would show a good sign of faith from the government to private enterprise. Thank you.
The other thing is renewing our automobile registrations. I've tried calling those numbers, but I can't get through to that.
Yeah. Dave, I think that one you can do online. I think you can do the auto registration online. We're also trying to also automate the driver's license and the business and permitting. So, and Daphne's working hard to get that done by the end of this year.
Governor, this is Charlie
Hi.
from Alpha.
Yeah, hi, Charlie.
In the same line, my question in regards switching gears is, I think even in the private sector, we've had to adjust and at our processes and see, you know, looking at the gaps because of the situation, the pandemic. Has anything really jumped out as far as process with the administration to, you know, you just mentioned automating the license, anything else that you think that you would want to accelerate as far as automation and kind of moving forward? Because I mean, even in the private side, we you know, there's a lot of gaps that we've seen that we just didn't look at, and we're trying to kind of put the dots together now. So anything that jumps out that you would want to accelerate from an automated standpoint?
Sure, the whole government of Guam. I would love to automate the whole government of Guam. No, this is what I tell everybody. I want a government-wide enterprise internet, you know, because like, for example, Charlie, you know, you go to record your deed of land, right? That's manual, you know, but why can't we have, okay, Charlie recorded his property, it'll automatically notify Department of Revenue and Tax, and then we can tax you.
Right. No, absolutely. No, it's a win-win, I think, for both. I think for the process.
So yes. So some of this coronavirus money that they have given us they allow using that for update of internet and update for, because of teleworking, right?
Right.
A lot of people now are teleworking. Some of our government can't do teleworking because of the systems. They have to be at the office to do the teleworking, right? So these are some of the things that we are working to improve to make efficiency. So this whole coronavirus has brought out the importance of making sure you update and you're automated because of the whole teleworking. So the federal government is allowing these coronavirus funds to be used towards that. So that's why I'm saying Daphne wants to finish it by December 31st, because if you don't use it, you have to return the money. So
Right.
yeah, Charlie, I would love it if everything is automated, right? I would love it. So even in healthcare, healthcare is going to start doing too, so that if you go to FHP and you're seen at FHP, right, and tomorrow you go to GMH ER, if GMH pulls out your profile, they'll know that, hey, Charlie went to FHP yesterday, and this is what happened with Charlie, right? So it makes it more efficient, it makes it consistent. There's no, there's minimal rooms for error, all that. So GMH is getting to that point, and we're trying to get that automated also.
That's
So yeah,
that's great. And that's good to hear that we can use some of that funding, because obviously, money's always the key driver sometimes. So I'm glad that we're able to get some of that fund. So that's good to hear. So thank you, Governor.
I'll tell you something too, that we're still doing AS 400, right? I'm going, why can't we go to the cloud? It's like, I'm not.
Absolutely.
Hey, Governor.
Thank you, Governor.
Hi, Gov. This is Phil. Thanks for joining us today. So if you were to close your eyes now and open it up and it's June of 2021, what would you see?
I would see a vibrant Guam opened up.
Good answer.
Hey, when we started this in March, I was thinking it'd be over in 3 months.
Yep.
But Phil, wear your mask.
Distance. Actually, I have my plastic on.
Even if you social distance, when people speak, right, they spit out. The virus is there.
Okay. Don't admit that, Governor.
Governor.
Is your son joining us? Is Ken on the line on this one, or did you beat him again by another meeting again?
I don't know if he's on the line.
Governor, I have a question.
Sure, Ina.
Hi, good afternoon. Thank you very much for your hard work and tremendous work, and your health is still healthy. I handle administration services for Korean community. I have several people complaints about stimulus check that they have not received.
Oh,
so a lot of people have not received stimulus check. So when I contact the income tax and revenue tax, they say still on pending and waiting for some other, but some senior citizens and elderly are really kind of not happy about not receiving stimulus check. So I'd like you to find out what's the holdup. And then public assistance program. I have elderlies have 400 cases that I help to fill out the forms for Section 8, GURA, and food stamp program due to they had lost their job. So they apply. I help 440 elderlies and senior citizens to apply for a food stamp. GURA Section 8 was still on pending, and it's very late response. So they always come to my office. What can we do to help them to get more information? I know everybody's on a waiting list. They only have availabilities at Agat and Talafofo for GURA, but these senior citizens were working as a tourist taxi drivers and some part-time jobs, but they have lost their job because of this pandemic. So they are applying for a public assistance program, food stamp, GURA, and Section 8, but the program where the public health is very, very lately response. So Governor, I know you're working very hard. You have a lot of work to do, but we need to handle this low-income people, especially elderlies and senior citizens.
Yeah, and so, Ina, I don't have an answer for you, only that, if you could just bring it up to Ray Tapasnia's attention, the director of GURA, and also Arts San Augustine, who's the director of public health, and of course Daphne. But if you could bring those up. The only thing I can think of with the food stamp and all those other ones is maybe income eligibility might be an issue. And so that's the only thing I could think of. But you're saying they're not even told whether they're eligible or not, right? You're
Yes,
saying
yes.
they're still
There's no
waiting for some
response. Still
answers.
waiting, yes, yes.
Yeah, so I know with the economic stimulus, I know that they are still paying that out as they file their income taxes. They're still
Yeah.
paying it out. So when they say it's pending, it's probably correct. But I don't know, what the holdoff is, if they are already all filed and they already are ready to be paid. So I know that the economic stimulus checks are still being sent out.
Yes, yes, but would be nice if they receive any kind of information. Why was it hold up?
Yeah.
What was it pending for? Because elderlies and senior
So if
citizens.
if you call Daphne at Department of Revenue and Tax, or and give them the name, give her the name of the people, and she can check that against her system and her file.
Okay, we'll do that. Thank you very much.
All right, Ina.
I have one, Gov.
Hi, Bernie.
Up a day, Gov. Bernie. Sorry, I'm late if I've asked this question before or if someone else has asked it. The educational video released yesterday by the physicians group was very, very well done. I don't know if Kaz or someone else did that, but I wanted to know what the strategy was to ensure that gets out, because a good program would be to make that frequent and repetitive. It's a 3-minute program, but I think it's important that it gets out frequently and to everybody. And also, if there is no plan, because there is no money, for example, to buy on KUAM or PNC, how can we help, whether it be the Rotary or any of the organizations? For example, I often have extra slots. They're not 3-minute slots, but they're 1-minute slots. Is there something we can help? Or the Women's Chamber? How can we help to get that word out? Because it's a very good one, and I think everyone needs to see it many, many times.
Yeah. So I don't think Kaz did that. I think the doctors did. Who did it? I think it was just Dr. Cabrera. He filmed it himself. So, Kaz, you have competition now.
Well, I do play a doctor at home.
But yes, it really is very educational. And we do have plans to boost it. I just learned that word, Bernie, boosting, right? So we're going to be boosting it in social media. And there is a plan to put it out in, TV and radio and all that. There is actually a total communication strategy plan of not just that being put out, but other educational materials and videos that we have been doing. There's several other ones that are really good also, because of feedback from people. But yes, the plan is to boost it in social media and to and I will make sure that public health knows about your offer, Bernie, and your Rotary offer, and certainly our communications team. Thank you for that very generous
I can't offer
offer.
on behalf of Rotary, but I'm just using examples, right? There are many organizations out there that can post it on social media. And Matson, we have extra slots. I can do that, or Guam Women's Chamber. But I think it's in order for it to be effective, it needs to be frequent and repetitive. And instead of 10 messages once, it's more effective to have one message 10 times, for a kid to see. So thank you.
Governor, this is Beverly here. I have a question, and I apologize if this question has has been asked before, but I wanted to inquire more about the vaccines. When does Guam, they're going to be, that they'll actually be here on island? And then what is the plan for who gets the vaccine first, and, you know, like medical personnel or certain hard hit communities and so forth? So those two questions, when and who, in regards to vaccine.
All right. So, yeah. So yes, no one has asked that question yet, Beth. So we did submit our distribution plan for vaccination. We submitted it, you know, months ago to the federal government, and they did acknowledge that we have our distribution plan. I was on a conference call with the White House, their task force, and the science experts and the infectious disease experts were there, and they talked about the vaccines. And of course, they're excited about Pfizer, and they're excited about Moderna. Pfizer is about 90% efficacy, and Moderna is 95% or 94% efficacy. What's happening with the vaccines is they now have to submit to FDA an application for approval. And when they do submit those, they will submit their clinical trial data. And when they submit their clinical trial data, the FDA will review those data for safety and efficacy. Safety is very important to me also. So they haven't done that yet. My information says that they're planning to submit those data by the end of this week and early next week. When FDA gets that data and they review it, they also give it to an independent review board. And they go through an independent review board to dilute any kind of political interference, or, you know, any kind of interest conflicts, things like that. Once they do that, they could probably give a emergency use approval, which means that it's not an FDA approval, but it is given by FDA, and the emergency use approval, you can then use that vaccine. Okay, so they're not even there yet. What is going to happen? And we are in close communication with CDC also, and Region 9, and we just had a call the other day with the Region 9 people, because they're saying that Guam has opted to get vaccines from Pfizer, and that once that's happening, they will give Guam, I think they said like 2,000, but don't quote me on that number. But Guam will get it. And the priority is going to be the elderly, the most vulnerable, and then the healthcare workers. So Beverly, even though from a federal level, there hasn't been any kind of decision, right? And this is a thing that Governor Cuomo, the other day, we were on a conference meeting with the National Governors Association. Governor Cuomo will be meeting with President-elect Biden and Kamala Harris about just this, the vaccine. And there's going to be questions asked about what is the allocation? What are the deadlines? When are they going to get it? Who should get it first? Exactly your questions. Those questions have not yet been answered from a federal guideline perspective. So everything is in discussion. I think everything is leading that we might get vaccines here by the first quarter of next year. But again, there's no definite dates that have been set. Hopefully when we get those definite dates, we'll have a much better idea of how to plan of distribution here. But my question to them was, okay, so earlier Guam opted into Pfizer. I said, what if I want Moderna now? and I wasn't part of that. CDC was part of public health. So what if I wanted Moderna now? They said all I have to do is write them a letter and say, no, we're going to wait for Moderna. If we wait for Moderna, it's about maybe a 2 or 3 week delay. But I'm thinking, hey, if it's going to be more effective with Moderna, let's just wait 2 or 3 weeks. That was my thinking. But I have to meet with the various public health people and CDC people to make that decision. I do want you to know that I want the best for our people, okay? And we are there advocating for the best of our people. And that's why I think we have these financial aids, because I was in there with our National Governors Association every week with the White House saying, don't forget Guam. Guam doesn't have an unemployment insurance. We need to have this pandemic unemployment and so forth. So we got everybody working for us, you guys, out over there. The Secretary of Defense, although he's, they fired the poor guy, but I know he was really a nice guy too. I really liked him, and he was very supportive of Guam when I met him. And he goes back, and the poor guy gets fired.
Oh, poor thing. Governor, do we have enough PPE equipment at the hospital? And is there a need still to collect these things for our community?
We do have the inventory is good. And on the recent, I'll tell you this, the best decision I ever made, right, is allowing the USS Theodore Roosevelt to go to our hotels because they think we're just the bomb. Really, the Secretary of Defense, I don't know how many letters he wrote me thanking me. The Secretary of the Navy, he's going to give us excess land because of that. So we're milking it. We're milking it very, very hard. But anyway, the reason I said that about the USS Theodore Roosevelt is there's a directive made and a mandate made at FEMA and through INDOPACOM that whatever Guam asks, make sure they get it. Okay, so our PPEs, they're coming, they're here. We have over ventilators. We have over 79 ventilators that they've given us. The hospital tent that was here, the military, the Admiral Davison told Admiral Manoni here, keep that tent there for whenever Guam might need it, right? So the really good working relationship we have with the military, and they recognize the importance of working together with us. So Wayne, on your PPE thing, we do have, they're sending us the PPEs. We have the PPEs. We have for fire department, for public health, for the police. But if people still want to donate, we certainly will accept it, because what we're doing also is we are planning for the next crisis. So we are buying a warehouse. We are putting all this inventory in there. So when the next pandemic occurs, we'd be ready. Readier.
Governor's Bob Kelly again. You've got all the Rotary clubs represented here. Is there anything that the Rotary clubs in Guam can do to help you and assist you in whatever way?
Yes, please tell your employees, to wear their mask. Really, I totally believe President-elect Biden that if you just wear your mask, it'll save lives. And it's been proven. So anywhere you guys go, in businesses, anywhere, please just send the message out, throughout your whole employees. Wear your mask. At the work situation, make sure you social distance. If you can do more teleworking, do more make sure you sanitize your area, you clean your spaces. And if we continue doing that, I think we will be able to contain this virus. So through your Rotary members, everywhere you go. Hey, if you see somebody not wearing a mask, we say this in Chamorro, go like this to their ears because they're supposed to be wearing their mask.
Governor. Governor,
Yes,
this is Lucky Sakamoto. Hi, how are you? Thank you very much for your hard work. Some also mentioned that the Rotary, we have 5 clubs on Guam, and we also launched the Rotarian Against COVID-19. We call it RAC-19 Special Committee, and we are already having 4 subcommittees to work different areas like education, mental health, marketing, and disinfections, and so on. So we're trying to do in a long way, because I don't think this COVID will disappear like magic in a couple of years. So we're trying to keep this committee for maybe a couple of years to make sure we can help in whatever the capacity Rotarian can do. So if you have something, let us know, or let any Rotarian know, so that way we can just try to accommodate whatever the needs we try to fill.
That's such a great work that you guys are doing. Education, of course, is very important, and educating our public and educating our people and our community is very key. So one of the things maybe you might want to look at is get a bunch of business people and do like what the doctors did, right? Talk about, hey, we want you to come back to work. This is what you need to do to get back to work. Maybe COS can do it, and let's see who wins the competition between COS or Dr. Felix Cabrera.
COS, you got a challenge.
No, serious. I think
challenge accepted.
If the business leaders get together and people see you, other employers see you, employees see you, that'll go, man, that will go a long way. Long way.
Governor, I was going to save this for our Mint Talks podcast for you and I, but I'm going to just ask you straight out here. With the COVID app and other things that, trying to break the mold of what we used to do versus what we need to do. You're right. Everybody here's kind of said the same thing. We have to get everybody involved and feel like they're stakeholders. Now, without getting too deep into the weeds about, essential, non-essential, if businesses did get together and say, okay, my employees are all going to install their app, they're going to do some of these guidelines, we're going to really wear it all the time, not just the mask, but everything. And that ensures us to stay open and gives us some type of variance other than, just opening up the general private sector with just guidelines, but rather very similar to health code that restaurants have to follow. Any restaurant can open as long as they have a grade A, and then they get closed down if they get a grade B. I think because this is a health issue, we treat it as a health issue. And I lived in California for a long time, and not to compare the smog alert with COVID alert, but essentially the same sort of logic where, okay, it's really heavy with smog today. Well, guess what? Californians didn't go out; they stayed home. And I think that maybe the media could do a little bit better, since we have them on here, to report much more than just death counts, much more than just positive counts, but really like getting more into the the listing of, okay, it's really heavy now, so you might want to, and you might want to avoid public places rather than just simply making it a transactional reporting. So just something to discuss, and I'm always available to talk to you and listen to you anytime you want. You know how to find me.
Hey guys, before we switch this off here, I just want to say how much more relaxed you look today than you did a few months ago. So I'm glad that you've gotten control of this. And I think the last time I talked to you, you said, "Are you sleeping?" Then you said, "Sometimes." So, but I want to say your face looks completely better now, like you're back to normal. It's a compliment.
Thank you. It's probably because I found it's probably because I found out that I'm a survivor of COVID, right? And now I have a lifetime immunity.
Right on.
No, but you know what? You know why, Phil? I do feel like we have a better control of this. And although, like I said, the construction company has caused a surge, but I feel that we have better ability to handle that, right? And there's some things behind the scenes in here that are happening, that are good things happening in terms of working this COVID. So, like vaccines may be coming soon. Automation of public health is coming real soon. Just things like that that make things a little bit easier to deal with. And I guess also adjusting to the fact that this virus will never go away. This virus is not going to ever go away. And we as an island community need to adjust to this virus. Do I accept that this virus is here? Absolutely not. But it's here. It's reality. I have to accept that it's, reality. And so what we do, I think is what we're doing is right. What we're doing is correct. What we're doing is, based on science and data, and I feel good that we are addressing it. I don't feel good that the numbers are still very high. I feel very comfortable and confident it'll start going down, and we're seeing it to start going down. So thank you for that observation, Phil. I didn't know I'd really look bad a few months ago. Probably when I had COVID.
I've got a question.
Sure.
Go ahead. I'll yield. All right, I'll ask it.
It's Dave, right?
Governor, hi. If you could talk about the hospitalizations and really from the aspect of, I know that you're focused on the number and the number of beds and the number of ICU patients and the limitations of GMH, and it's emphasized, all that we've got to put into GMH. I'm wondering, is there any plan to use any of the CARES money left to put those upgrades in, and maybe talk about potential for public-private partnerships or anything we can do to help GMH survive?
Okay, so with GMH, the capital improvement projects that need to be done there, I don't know if you recall, we had the Army Corps of Engineers come in and do a really thorough evaluation of structure and so forth. And the immediate need there is to fix the roof and do the air handling, and I think the other one was electrical. So GMH is already in progress to fixing those. GMH, we need to build the new hospital, and that's my direction right now. I'm working really hard towards that direction. Army Corps of Engineer has advised that even if we do renovate it, we probably wouldn't get it to the level of it can address the best standard of care. So what that means is our hospital right now was built like 45 years ago, almost 50 years ago, and it was built for the standard of practice and care at that time. In order for our hospital to get to the level where we can provide the facility that would allow the best practice of healthcare, is going to take a lot of money, more money than building a new hospital. So the board of the hospital decided to build a new hospital. And so now I'm in the process of getting Navy excess land to build our hospital. And that's looking really good. I am also working with federal government to help us with the planning of the new hospital. I just met with the new leadership of the U.S. Army Corps of Engineer out of Hawaii, and they are very willing to help us with architectural design, you know, all of that. I have Gita working on what are the financial options that we have to building the new hospital. So thank you for that concern. You're absolutely right. We do need to upgrade the hospital, not just for the long run, you know, for the long run. And whether we privatize the operations or not, we definitely need to have a new facility. Absolutely.
Thank you.
Okay. I think we should just probably call it. We kept the governor for quite too long already. She's very busy. You know, really appreciate it, Governor, for taking the time to just basically address our club and hear our concerns and ask just about every question we had. You know, you're doing a really great job, and I think even the people of Guam, for me personally, I think we've been very compliant and doing a great job keeping our masks on. You know, I talked to my family members on the East Coast and West Coast, and they encounter people not wanting to wear their mask and refusing to and arguing and fighting about masks. But here on Guam, we're doing a really great job on you know, just keeping it on, following directives. Businesses are doing what they can do, and you know, we're being very compliant. So you know, thank you for all your hard work and sleepless nights.
Thank you for all your support. I do have to say businesses have been very, you know, they've been very concerned and they've been very cooperative. And, you know, I think they've been very brave also to self-report themselves when they do have positives with their employees. But we need to do that in order to recognize where we're at in terms of this coronavirus. So I do appreciate, and I appreciate also all the Rotary clubs and, you know, their desire and their generosity to helping our community, helping our frontliners out there. So thank you. And I think, you know, together we are going to win this battle of this virus. Thank you again for the opportunity.
Thank you very much, Governor. Thank you for coming.
Thank you, Governor.
Thank you.
Fellow Rotarians, we have no meeting next week, so I just want to say happy Thanksgiving. Wear your mask when you're checking out your family members. So I'll see you all in about a week and a half or maybe 2 weeks. Our guest speaker will be the representative from Taiwan. We might be doing it on Google Meet, so just look out for any links or how to set that up on your end. So again, thank you for joining us, and happy Thanksgiving, everyone.
Happy Thanksgiving.
Thanksgiving.
Thank you. Bye-bye.
Bye.
Be safe.
Hey.
Oh my God.